Ms. Mayer, am I pronouncing it right? Meyer, we're here to hear your application for licensure, and the floor is open. Oh, before you have any testimony, turn your attention to the court reporter, and she's going to swear you in, so your testimony is on the record.
You'll raise your right hand for me, please. Do you solemnly swear or affirm under penalty of perjury to tell the truth and nothing but the truth, so help you God? I do. Thank you, ma'am.
Statement first, or we have a member of the board to ask you questions. How would you like to proceed?
I'll make a statement.
Okay.
I'm a physician assistant, and I here in 2019, and I recently just applied for my South Carolina license. Previously, I held licensure in New York and New Jersey, and I worked in an emergency room in New York City for about 13 years, and in a primary care office for about 2 years. And after I stopped working in the emergency room, I opened up an LLC and really support group for food allergies because I have 2 children with food allergies. So in 2015, I wasn't working as a PA, but I really just opened up a support group, and we had meetings and a Facebook group with around 600 members, and that's been open since then. And I basically renew my my certification through NISPA. I take my exams about every 6 years. CME I have to renew every 2 years. I believe 100 hours. I belong to many physician assistant groups that I'm always updating my medical knowledge just from reading, and but actually applying now because I'm considering going back to work and maybe working in either urgent care or allergy. There's no jobs I've actually looked at, but I just figured it's time for me to reapply.
Thank you. Dr. Root?
Well, you answered some of my question. So I had down in the application that you worked in the emergency room till 2010, so it was longer than that?
I believe it was 2011. I don't really remember the exact date I left.
So you've been out of practice now for 14-ish years? Okay. And I had the question on here about how you maintain certification, but you already answered my question, so that's fantastic. And where have you been living? You've been here in South Carolina?
In Fort Mill.
Fort Mill, okay. All right, very good. Are you a little bit nervous coming back after such an extended leave without any official education or additional training or any of that sort of thing?
I'm more excited than nervous. Maybe a little nervous being here in front of everyone, but I think I'm a little excited to actually, get a license in South Carolina if I'm able to. And now that 2 of my 3 kids are in college, I only have 1 more home still. I thought maybe going back part-time might be nice. I always loved medicine. I always loved urgent care, emergency, things like that. So I was recently looking at a few that opened up near me. So that's when I said, you know what, maybe I'd apply, and, if they need extra help, or, I like to have my license in case there was ever like another pandemic or something, just to be able to offer my help if needed, so.
Done questioning. Anyone else?
Yeah. Most urgent cares have some credentialing body, and of course, all emergency departments. And they're going to be required by state and federal competency. So I would counsel you as to be prepared for the procedures, because it's one thing to keep current with CMEs and pass the certification exam, but there's certain practical things that we do, and you know that as
Right.
a PA did in the past, that there's probably going to have to be between you and the physicians or the organization some graded proctoring, precepting when it comes to procedure. So just so you know that.
I understand.
Else have any questions, comments?
I would just like to echo what Dr. Wright said, having been
Yeah.
application, Doesn't, I mean, we understand you're doing CME, which is great, you know, because some people come here and they haven't done that, right? But certainly whoever you're going to talk to, you know, ask them about developing a back-to-work plan, proctoring and, or precepting and into it, just for your own.
Yeah, I would be very willing and open, and I would love for them to say, you know, prove to me that, you know, you still know how to do procedures, you still know, you know.
That's why, and we've done it plenty
I'm
of
fine with.
times, you know.
Right, right. Thank you.
I'd like to make a motion that we, at a future time in this meeting, enter into executive discussion. We've just heard concerning licensure. Is there a second?
I'll second.
All's in favor? Any opposed? What that means is the information you've just given us, at some time during this meeting, we're going to go into an executive session, discuss all that, and make a decision as to proceeding with your license or whatever guardrails we put around that criteria, and we'll have the board administrator communicate with you our decision. Okay?
Yeah, if, I'd just like to add, also when I started as a PA, I didn't have any experience, and I was luckily allowed to get an emergency room position and a lot of on-the-job training, and after being there for so long, I feel like I've really learned a lot. So yes, I'd be definitely willing to, if I did start again, you know, have a preceptor watch me and everything.
We appreciate you coming here and your willingness to help increase our workforce, but we have to ensure that we do correctly. So our decision will be communicated to you from the Board of Medicine Administrator. Thank you.
Thank you so much.
Also,
You're in open session.
we're in open session. Okay. Ms. Traharni?
Harn.
Traharn? Pronounce it. I was close. I'm not good at names. So you're here to apply for licensure as a PA. If you want to make an opening statement, and then we have questions, there might be some follow-up questions from another board member. Before we proceed, turn your attention to the court reporter. She'll swear you in, so we have your testimony on the record.
Raise your right hand for me. Thank you. Do you solemnly swear or affirm under penalty of perjury to tell the truth and nothing but the truth, so help you God? Thank you.
You're going to have to speak into the microphone so that the red light comes on. It's the only way. So this is an open meeting. It's broadcast on YouTube. It's part of our public records. So the only way they can hear you is if the microphone is on. So just try to be cognizant of that.
The red light. Okay, it's on. Yeah, so I am a physician assistant. I have not been practicing since my husband and I moved to South Carolina 8 years ago. I am a clinical diagnosis instructor at a chiropractic college. I teach various diagnostic courses, systemic pathology, visceral disorders, dermatology, toxicology, clinical reasoning, and occasionally I teach phys exam whenever there's more than one section needed. I was pursuing my licensure in South Carolina 4 years ago and to help out a family doctor who was looking for someone to kind of help with the annual exams, the sports physicals, some acute care because his office was overwhelmed. I started that process, and unfortunately, we had a death in our family, and my children needed me at home. So I kind of walked away from that opportunity. Now my children are mostly all grown, and I was just looking to potentially re-enter practice in a part-time way. I love my job teaching, but just looking to fill my time and not be idle. So that's my story.
Dr. Root?
Thank you for coming here today.
Yes.
So you are not only just teaching at a chiropractic school, you also have a chiropractic degree, correct?
Correct. My family jokes that I just like to go to school, and now I'm getting paid to go to school. So
Wrong with being a lifelong learner. That's what
I
all of us
love
in the
it.
room are. And so how long have you been in South Carolina?
8 years.
8 years, okay. And I saw that you did keep up with all of the CME requirements and all the certification requirements. I'm assuming that to maintain your certification, there's courses that you have to stay current with and all that, correct?
Correct. There's a 2-year cycle for CE, and I have maintained that the whole time. It is also helpful for me to maintain that because it's the topics that I teach.
Where were you a PA when you were practicing?
I worked in Illinois and Iowa, so my husband and I lived kind of on the border. So if you crossed the bridge, you were in Illinois. So I worked in practices on both sides of the Mississippi.
And what kind of medicine were you practicing?
Initially I practiced family medicine. I was the PA for John Deere Medical Group whenever they took care of all of their people. And so the only people in the clinic were those families. And they wanted the OB-GYN care to stay in-house. So I became the pap smear lady, I guess. And I did some just general family practice. And then I went to school to be a chiropractor. And while my husband, he is a chiropractor, while we were building our practice, I went back to school to supplement our income, and I worked in gastroenterology, and that became my area of focus and specialty.
That was all my questions. Anyone else?
What are your plans coming to South Carolina?
Why did I come to South Carolina?
What are your plans to practice?
I am really just looking for something part-time to keep my skills and my knowledge up. What I learn out in practice, I can bring back to students. Like I said before, I was looking to help a local family practice person. I know that being out of practice, I'm not looking to go do surgery or, really intense focused specialties because I would want to become more familiar with that once again.
I would just tell you to be prepared. A physician has to, agree to supervise and collaborate with you when it comes to practicing as a PA. And they're also, by that, said how are they going to do that and ensure quality and that scope of practice. I think you should, when you discuss with some of these practices, you're going to have to look at a return to practice plan.
Oh, absolutely.
Taking responsibility and just, that would benefit also.
Oh, I would assume that they would look at me as a new grad that's very wet.
Anyone else have any questions?
Where are you teaching right now?
I teach at Sherman College of Chiropractic in Boiling Springs, which is up in the upstate.
In South Carolina?
Yes.
Okay. Thank you.
Any other questions? All right. I make a motion that we go into executive session at a future time in this meeting to heard and make a decision. Is there a second?
I'll second that.
All in favor? Any opposed? What that means is later in this meeting, we're going to enter into an executive session to discuss your testimony and other information. And then the board administrator will be in contact with you about how to proceed with your license. And all right, thank you.
All right. Thank you for your time.
Expanding the scope of practice.
Microphone.
We're in open session. Good afternoon, Ms. Strickland. Welcome to the Board of Medicine. You're here to discuss licensure as a PA. Would you like to make a statement? And then we have a board member that will ask you some questions. Oh, wait, before we do, turn your attention to the court reporter, and she will swear you in so we can have your testimony on the record.
Raise your right hand for me. Do you solemnly swear or affirm under penalty of perjury to tell the truth and nothing but the truth, so help you God? Thank you.
Just ask that you make sure you're talking into the microphone. It should light up red when it's picking you up.
Hello? There it goes, okay. All right, well, actually, I'm applying here in South Carolina. I've recently moved to the area in October. I had taken some time off from being a PA when I was in Virginia. My husband was self-employed. I was working for Bon Secours as a PA in rural medicine at the time. He was starting his own oyster business, and we lived on a 15-acre property along the Chesapeake Bay and decided to expand our operation into vegetables and produce. And at the time, we basically delivered to Baltimore, Washington, D.C., and the Richmond area. I felt this was sort of a parallel complement to my lifestyle. I've lived a healthy lifestyle even when I was working for PAs. It paralleled working with my patients to encourage healthy lifestyle. And we, with regenerative farming practices, had an organic farm and developed nutrient-dense foods and delivered to the area. But life circumstances change. I'm here in South Carolina, being closer to family, and would love to be reinstated so I can serve as a PA here in South Carolina.
Ms. Strickland, just a few questions. I'm Dr. Root, one of the board members. I was reading through your information, and it says that you finished up your PA degree in 1994.
Correct.
And so I saw that in 2012, I guess you were working in primary care in Virginia, but I didn't see anything from 94 to 2012.
Yeah, I sent a follow-up. When I was doing my resume, 3 pages is really long, so I kind of cut it back a little bit. But yeah, right from 94, I have been employed all the way through there. I have an updated one if you'd like. I thought I mailed it.
That's okay.
When
Just
I mailed it in,
let me
but-
know kind of generally what kind of practices you were working for.
When I came out, I was in primary care, and I worked in a subacute rehab facility at long-term nursing care. What is it called? Lifestyle. It was in Attleboro, Massachusetts. From there, I ended up I worked with a pediatric cardiologist, actually, for a short time, and then that's when I went to Roger Williams Medical Center, where I did surgery. It was in a mostly oncology hospital, and I worked ICU. It was a surgical on-call shift. I was 24 hours on, mostly in the ICU. They needed us.
And in 2018 is when you stopped and started with the family business.
Correct.
So basically 8 years ago. Have you maintained your certifications?
I did. I maintained my CME, and I just recertified this January. I took the national exam and recertified January 30th, first time.
No other questions?
Yeah, just a note of awareness that when you enter into a supervisory agreement with whatever physician you, they're going to require some return to practice as competency because, you know, even though we keep up with CMEs and recertify, there's certain other skills within practice that we, certainly if you're going to work within a hospital system or they're going to require just to be aware of that and be thinking about what skills that you would be doing and I'll make a motion at this time that at a future time in this meeting, we go into a session to discuss this matter. Is there a second?
I'll second.
All those in favor? Any opposed? Ms. Strickland, what that means is at some point in this meeting, we're going to go into a session to discuss the testimony you just given us and your application, and then we will forward you our decision about licensure. The board administrator will be in contact with you. All right?
Thank you for your time.
All right.
Or 220 might be available. I'll find out.
At this time, as we try and contact the individual.
Thank you all. I'll try to be brief. I had in the secure folder just an update on AI applications. The agency is creating some new applications, and so we're utilizing AI just to look at documents that are being uploaded and making sure folks are uploading a complete application package. So that actually went live last week and seems to be going so far so good. So just a note on that. This last week, I had the opportunity, along with Dr. Root and Dr. Selesky and a Vice Counsel Horner, to attend the FSMB conference in Baltimore, and it was a lovely experience. Got to learn about what's happening in other states. The first day I attended the Administrators in Medicine meeting, where we all of the administrators, there are 46 states, I believe, represented, got a chance to talk about what's happening in our states, learn about all sorts of different things from IV hydration to what new rules folks are implementing for ketamine. So that was interesting. If any of the, if Dr. Root or Dr. Selesky have any comments, otherwise I think it was a great conference. Another note would be we have some upcoming renewals. Right now we are in limited licensing time, so we're renewing all of our limited licenses as well as our academic licenses for those who hold academic licenses, and then we're preparing for doing our first ever athletic trainer license renewal. So that we'll be starting that here in the next couple weeks. So that seems to be going well so far with those academic and limited licenses. Next on the agenda is the athletic trainer regulatory training. Every 2 years, the athletic training, the Board of Certification in Athletic Training puts together a regulatory conference, and speaking with the athletic training committee, they asked that we send a representative. So I'd like to get travel authorization to attend a 2-day conference in Omaha in August.
Second, Dr. Gregory. All those in favor? Any opposed?
Thank you. I appreciate that. Next is the PA committee. We met last in January, and since then we did get a application from Dr. Cole to replace Dr. Gardner, who has served 2 terms, and so I would ask the board to consider a motion to, if they so choose, to appoint Dr. Cole to serve as the PA committee member for the vacant seat.
Questions about that? Can you just give Dr. Cole's background briefly?
Yeah, he has a rather long CV, and give me just a moment to pull it up.
He's been with the PA committee, and
He has not, Dr. Call has not been with the PA committee. Dr. Gardner had reached out to some interested folks to see if anyone was interested to fill his seat. And Dr. Call is, I believe, a surgeon, if I remember correctly. And he seemed interested because he works with PAs, but had a rather long CV.
anybody have any questions about Dr. Cole?
Move that we, Dr. Cole on the PA committee.
All's in favor? Any opposed? No opposition?
Thank you. Next, we had a respiratory care committee meeting in April, and we'll be meeting again in July. We did have 2 recent committee hearings. We haven't, in my time here, we've only had 3 committee hearings, and 2 of them were recommended for licensure with the board, and we wanted to bring those in front of you to.
Yeah, they were recommended for licensure with conditions. The recommendations should have been in your board materials. The applicant fine with the recommendations as written, but ultimately the board has a say-so in that. They're not present because they were happy with the outcome. So if there's No objection to proceeding with licensure with those 2 RCPs with the conditions outlined. Recommendation, I would ask for a motion to approve both recommendations.
I'll make the motion to approve the recommendations. Is there a second? All those in favor? Any opposed?
Thank you.
Mr. President, can I just ask a quick question on
Yes.
PA? Dr. Cole, does he, I mean, he agreed to do it? Does he know how much is involved?
He spent
Because-
some time talking to Dr. Gardner and did submit a letter of interest. And so I believe Dr. Gardner spent a significant amount of time talking to him about the position.
The reason I say that is that IRC, once a month, no big deal, Jim Chow. You spend 2 to 3 days per month reading these charts like we see. It is unbelievable. There are like 45 charts.
But this is the PA committee.
I'm just wondering, it's nothing like that, because that
no.
takes a lot of commitment.
I'm on the PA committee,
Oh,
so.
oh, then everything's fine then. Oh, okay. So there's multiple people on the committee. It's not just one. Oh, okay.
No, it's myself, Bob is there, there's other PA.
Oh, okay. My apology. I thought there's one person.
And Dr. Cull has been in leadership, departmental and other surgery organizations.
Because sooner or later, I know this is not a time to bring it up, but IRC, Dr. Kowalski is going to be the president of the AOA, and he's not going to have time to do all that stuff. That job is so time consuming. It takes a lot of leadership and knowledge to run that thing. I mean, he got it down to a science, but that man must spend 3 to 5 days a month on IRC for the big, reward.
I mean, not to have you as the spokesperson.
Thika, I know that there was some regulations that were sent up, I believe, back in January. Is that correct?
For the
For
anesthesiologist
AAs,
assistants.
there were a couple, I thought there were a couple. The PAs,
PAs we got approved last year for those CMEs, but for the AAs, yes, that we have sent them in. We're just waiting for them to do the 180-day
We'll let you
process.
finish, and then we move on to our, is that it?
Just a couple quick other notes. We weren't able to have a anesthesiologist assistant committee meeting. Unfortunately, we didn't have any additional business, but we'll be able to host that next meeting in October. We have an upcoming athletic trainer meeting in July. And just a note, we do not have, there are 2 seats that are up, but those are not elected seats. Both are the appointed seats. So with that, I'd stand for any questions that the board would have.
All right. Are we ready with WebEx?
I did have one other question, Jess. I know that at our last AA meeting, which is October, there was some discussion about how the words supervising and with sponsoring were being used interchangeably, but they were very different. So I don't believe I've seen the final copies of all the
The new forms.
new forms.
I
If could-
think that we need to get those out to you, but I will get those to you.
All right, let's bring them in.
Dr. Eisman and Dr. Okay, can you unmute? We're available, ready to have you speak.
Yes, thank you so much for allowing me to present. I'm sorry, I'm not sure why my video is not working, but hopefully you can hear me.
Yeah, this is
okay,
Dr.
great,
Wright.
yeah.
Before we proceed, yourself or Dr. Oki, or Kiki, please turn your attention towards the court reporter so you can be sworn in, so we have your testimony on the record.
Sir.
You would each raise your right hands for me, please. Do you solemnly swear or affirm under penalty of perjury to tell the truth and nothing but the truth, so help you God?
I do.
Thank you.
All right, I will open up the floor to you, and then there'll be some follow-up questions from one of our board members who's reviewed this application, and then there might be other follow-up questions from the board.
Oh, perfect. Yeah, and once again, thank you so much for this opportunity to present this truly outstanding candidate to provide much-needed care in the state of South Carolina. I'm the chairman of the Storm Eye Institute in the Department of Ophthalmology at the Medical University of South Carolina. And Dr. Okeke has already completed multiple fellowships, including a prior fellowship in pediatric ophthalmology at a highly esteemed training program, and is currently in a neuro-ophthalmology program in Michigan. And our goal is to bring her onto the faculty of Storm Eye as a pediatric ophthalmology fellow, but our fellows are independent practitioners for comprehensive ophthalmology while they're learning additional skill sets in the realm of pediatric ophthalmology. And I just have to say that pediatric ophthalmology is a critically underserved field in the nation, and specifically in South Carolina. In fact, the Storm Eye Institute has the largest pediatric ophthalmology practice in the state of South Carolina, and unfortunately, two of our most senior full professors with over 30 years of experience, one recently retired and the other is going to halftime next academic year and will then be retiring. And so this position is even more critical for us because of the deficit of supply, basically, for just an incredible demand for these services. They not only take care of children with visual issues, but are obviously the surgeons for children with droopy eyelids or crossed eyes, patients with pediatric cataracts and pediatric glaucoma, which can be blinding disorders. And so this truly is a critical fill for us.
Dr. Shaleski? Oh, Dr. Gregory, I'm sorry. I knew I was looking over in that area.
I'm Dr. Gregory. It's nice to meet with you guys today. After reading over everything, it seems like it would be an honor on our part as board members of the state of South Carolina to welcome Dr. Okeke to South. Is there a chance that she could tell us just a little bit about her training?
Yes. So my training, I started my training in Nigeria, where I did an ophthalmology residency in one of the biggest university hospitals in my country. And thereafter, I did a residency in ophthalmology, and I went ahead to do a pediatric ophthalmology fellowship. The first was in Bangladesh, where I saw a number of diverse cases catered for a number of pediatric ophthalmology cases. And after that, I went to the UK in Birmingham, where I did a master's in health research methods. I wanted to add evidence-based medicine to my patient care. And after my master's degree, I came to the US and I did another pediatric ophthalmology fellowship, but this time around in Children's Mercy Hospital, Kansas City. And I concluded that this year and went further to start a neuro-ophthalmology fellowship, which I'm presently rounding up. I should be rounding up with that by this month. So that's a little bit of my journey academic-wise.
And then the fellowship.
May I? Oh, I'm sorry. Yes, ma'am.
The fellowship at MUSC is in what additional training will she be doing at MUSC?
Oh, yeah, thank you. So she will be completing another pediatric ophthalmology fellowship to really continue to expand her skill set. Each pediatric ophthalmology fellowship is a little different, has a different emphasis. One of the things that Storm Eye does is really provide a very comprehensive training program, including intraocular pediatric surgery. There are some pediatric ophthalmology fellowships that train their fellows to do eye muscle surgery, which is crossed eyes or eyes that aren't aligned. But because we are the biggest group and because we have all of the subspecialists in the state of South Carolina, almost all of the pediatric cataract surgery, all of the pediatric glaucoma surgery, and almost all of the retinopathy or prematurity treatments and evaluations are done through Storm Eye. I mean, obviously there are places in the state where some of that's done, but even when they're done elsewhere, any complicated or truly difficult case eventually winds up with us. And so that will really kind of complete her training. And after that, there's basically no place that wouldn't love to have her because she's going to be completely trained. The one other thing about neuro-ophthalmology is that also is a field that often deals with malaligned eyes, but also deals with optic nerve disorders. And to have someone who does both neuro-ophthalmology and pediatric ophthalmology is a real strong point. We only have one full-time neuro-ophthalmologist, and he's not as comfortable seeing children as adults. And so having Dr. Okeke will absolutely improve that for us as well. And the one other comment I wanted to make, sorry, I don't mean to take up too much of your valuable time, but just to let you know that the American Association of Pediatric Ophthalmology and Strabismus has put out several sort of papers and different studies showing that because of the critical shortage of pediatric ophthalmologists in the U.S., that there is a significant greater reliance on incredibly well-qualified surgeons and ophthalmologists like Dr. Okeke, who graduated from foreign medical schools, but we're really relying much, much more on their expertise because in the U.S., there's just not enough young ophthalmologists who are going into the field. And so it's kind of getting worse and worse and worse because it takes so long. The pipeline is so long, as you guys know, to get a fully trained pediatric ophthalmologist to go out and practice on their own.
Any other questions?
This fellowship is just a one-year training
Yes,
program?
ma'am. It's a 1 year. Sometimes we'll actually have a fellow who will even do a second year. That's not uncommon. We have someone this year who's doing their second year. And once again, it's really just a matter of how much they get to see and how much they, what else they want to see. But the plan would be for 1 year, but it could be extended if either desired by the candidate or if we needed additional access for our patients.
A quick question on the licensure. What is she qualified licensure in Nigeria, in UK, and?
Yeah, so she is not board certified through the American Board of Ophthalmology. She will eventually be able to sit for the boards. I'm very active in the board, and there is an alternate pathway now for board certification. It requires first the academic license, and then once that is done, if you then have an unrestricted license in any state for 5 years, you can then go through this alternate pathway. And so she is actually already completing neuro-ophthalmology and pediatric ophthalmology, so she could potentially even do that independently, but she just wants to hone her skills a little more. And Storm Eye is a very unique program, like I said, with the intraocular surgeries that a lot of other programs don't have. And so she will be able to see any patient independently that she's already, that she would be credentialed to see, but she wouldn't be doing pediatric intraocular surgery on her own or doing pediatric glaucoma surgery on her own. That would be mentored by the fellowship attendings, but certainly seeing, the more routine, comprehensive patients on her own, we would certainly credential her for that.
Just let me clarify. So she has taken USMLE, all three parts already?
Oh, yes, sir. Sorry. Yes, she has ECFMG and has actually completed part 3 as well, which, as you know, is not required.
She's just simply not eligible to the ophthalmology board. Is that correct?
Exactly. So she is not yet eligible to sit for the American Board of Ophthalmology written and oral examination. She would require, we have several graduates from foreign medical schools at Storm Eye who are now getting to become available or qualified to do that, because you need the academic license for, and you all know that, correct me if I'm wrong, I think it was 2 or 3 years, and then you can get an unrestricted license. And once you've had an unrestricted license for 5 years, you can then sit for the American Board of Ophthalmology examination. And so she is what we would consider board eligible, but not able to sit
I
for
understand.
them.
So basically, she had taken all 3 parts. She have already completed a 1-year internship. Why couldn't she just get a South Carolina license? I don't,
You have to have 3 years of progressive postgraduate training if you're a foreign educated candidate.
so there is a delay. So that's why. So in her case, she will be only used for academic purpose. She will not be sending to another clinic to generate RVUs.
Oh, right. No, sir. Yeah. So this is absolutely an academic program. I mean, there are some patients that she'll, that would be assigned to her in clinic, but they're all proctored by the fellowship faculty. And, there will be times where she might be, taking care of a patient, but there's always ready backup. But yeah, no, I mean, this is a training program. It's not about revenue generation. Absolutely.
Thank you.
Is there a motion?
I would like to make a motion to approve.
Second.
So the motion is to proceed with academic licensure. All those in favor? Any opposed? All right. Well, thank you very much. You can proceed with licensure.
Yeah, thank you, ladies and gentlemen. Really appreciate your time, and this is great. Really, really appreciate it. Thank you so much.
Thank you so much.
Thank you for coming to
Have a great rest
AMUSC.
of the
Yes.
day.
Good luck.
Thank you.
All right, I want to make a motion that we enter into closed session. Is there a second? All those in favor? All right. Doctor, what that is we just close this